Can you please grab the vial that says regular insulin? And then I'll have you grab some alcohol preps. And in the top drawer of the cart, can you see if there is a syringe with an orange cap, please? Yep, that's correct. Thank you. So the first thing I want you to do is I'd like you to take that insulin vial, and can you gently roll it between your hands? So we want to mix the insulin, but we don't want to shake it up. Okay. So after that, I'd like you to wipe the top of the insulin vial with an alcohol prep for me. All right, and then I'll have you open the syringe. And take the cap off, making sure not to touch the inside of the cap or to touch the needle at the end. I'll have you pull that plunger back to the 5-unit mark. And if I look closely, I can see, yes, we're at the 5-unit mark. Thank you, perfect. Okay, I'm going to have you inject 5 units of air into the vial. And now please turn the vial upside down and draw out 5 units of insulin. Can you bring your camera up for me just a little, or your hands down? Perfect, thank you. And that is 5 units. Okay. So I'll have you pull the safety up, but don't engage it. Just pull it up so it's covering the needle. All right. Now if you could, I'd like you to go back and put some gloves on for me, and then we'll move to the patient bedside. So if you'll take your insulin syringe, and please bring some alcohol preps too. And we're going to work to maintain privacy here. We'll want to expose her abdomen, but try to keep the rest of her covered so she stays warm. Susan, we're going to give you that injection now. So we're going to slide your gown up. Is that okay?
Yes, that's fine.
Okay. So we have your abdomen exposed, and we're going to stay away from that right side because we did that shot there earlier. So let's look at the left upper quadrant, and I'm just checking for any redness, any bruising, any sign of infection, and I'm going to stay at least 2 inches away from the umbilicus. Now, could you please wipe that site with an alcohol pad for me? And scrub outward in a circular motion, please. Thank you. Perfect. Now we'll slide the safety down. And we're going to pinch the area that needs to be injected, making sure the alcohol is dry. And we'll give this injection at a 90-degree angle, making sure not to rub the area after we're done, and we're not going to withdraw or pull back on the plunger. Go ahead and give the injection. And please immediately engage the safety and throw that in the sharps container.